Hi, my name is Alana Rowe.
And I'm Emma Hall.
For this project, we chose the theme Emotion Regulation. We are from the Secondary Division, chapter number 32466, from Elsinore High School, California, HOSA.
Our target audience is our peers, our high schoolers, and the number of participants is 4. The date of presentation is March 13th, 2023.
So why emotion regulation? We chose this theme in order to promote healthy habits of emotion regulation and to normalize emotions. Our research question is, how do emotion regulation strategies affect an individual's overall mood? In this presentation, we will discuss the importance of emotion regulation and how to effectively manage emotions by providing strategies to maintain positive or neutral emotions.
Using these strategies, we will monitor the emotions of 4 participants over the course of 8 days. The first 4 days will be the pre-data of emotions, while the last 4 days will be the post-data after using emotional regulation strategies provided. What is emotion regulation and what does it look like? Emotion regulation is a person's ability to control emotions and respond effectively to an emotional experience. Example: your friend makes a comment that is very offensive, and while your first instinct is to yell at them, you instead take a few moments to think and calm down and then respond to them in a mature and positive manner. Why is emotion regulation important? Emotion regulation is a person's ability to recognize and manage their emotions, especially emotions that are strong or overwhelming. This is important because a person who can acknowledge strong emotions and choose positive coping strategies will be able to more easily manage their own mental health and long-term emotional well-being. A person who exhibits poor emotional regulation skills has difficulty managing and controlling states of emotion like anxiety, stress, sadness, or anger. This can lead to dysregulated behaviors like suicidal ideation, self-harm, substance misuse, and other high-risk behaviors. These behaviors commonly become coping strategies because they are quick solutions to repress the emotions at hand, but they often worsen the actual symptoms in the long run.
Emotion regulation is especially important to high school students because it can help with learning to regulate emotions on our own, experiencing hormone changes, transitioning from childhood to adulthood, and poor emotion regulation skills passed on from our parents or trauma that we are responsible for working through. Emotion regulation is achievable when a goal is activated. Goals are a person's desired result of a situation. Intrinsic motivation is when you are engaging in a behavior because you find it rewarding internally and not for an external reward. An example of this is playing a sport because you enjoy it. The second example is extrinsic motivation, in which you engage in a behavior to earn a reward or avoid punishment. An example of this is complimenting someone because you want them to like you.
How do coping strategies affect emotion regulation? Everyone experiences strong emotions, and your coping strategies are often what will make or break your perception of the situation that you are facing. A negative coping strategy, such as using drugs, will perpetuate the negative emotion that you are trying to avoid. A positive coping mechanism like journaling will help you rationalize and accept your emotions in response to an event.
Coping strategies that promote emotion regulation and emotional well-being. Journaling. This promotes emotional regulation by helping people lay out their thoughts and feelings. Listening only to positive music. Studies show that the media you consume does have an effect on your mentality. Mindful speaking. Reflect before you respond to others, especially when your emotions are heightened. And last but not least, positive self-talk. Be mindful of how you speak about yourself and refrain from negative self-talk. So how can this project benefit each of these members if we become health professionals? I believe that while researching for this project, I learned beneficial strategies to help myself regulate emotions in order to perform better as a future physician. I will now have a basic knowledge of regulating emotions and will be able to use advice to patients who may need emotional support. Any career in the medical field requires dedication and may be stressful, so regulating emotions is important. It's also necessary to maintain a positive attitude when interacting with patients to create a friendly workplace and a better overall experience.
I'm interested in pediatrics. Doing research for this project has helped me better understand ways to regulate my own emotions and how these skills can be applied to others. Many children are scared of the doctor, and so they'll be creating an emotionally heightened environment, which can be stressful when trying to do a job. Good emotional regulation on my part can benefit the children by helping them apply skills to calm down. Mindfully handling a patient's strong emotions will de-escalate the situation and create less stress for both of us.
This chart represents our pre-data of our participants' emotions. As you can see, their mood ratings did affect their overall day, and some of them even had very low mood ratings.
We recorded the pre-data before presenting to our participants, so they did not use any of the strategies that we have talked about.
After gathering the pre-data, we presented this PowerPoint to our participants and then asked them to practice the strategies provided. This chart shows the mood ratings in the morning compared to the participants' overall day after using the emotion regulation strategies.
Our hypothesis for this project was that if a person practices emotion regulating behaviors, their overall mood and emotional well-being will be improved.
Our hypothesis proved to be successful as the participants' overall mood was generally higher after using the emotion regulation practices.
So going back to our pre-data slides, before the participants used strategies, their mood ratings were pretty low or moderate. And if we move back to the post-data, our participants were using the methods that we provided, and their mood ratings were moderate and high. So their mood improved with the strategies that we asked them to use.
So after collecting all the data, we asked our participants for their personal responses. Male number 1 said, "I felt that listening to only positive music definitely affected how my day went and turned out. The journaling never really changed my mood." Male 2 said, "Personally, I found that self-talk and journaling didn't really affect my mood, but abstaining from listening to negative music that wasn't positive actually helped keep me in a good mood."
Female 1 says, "I have always been a journaler, so I know that helps me regulate what I'm feeling. But during this experiment, I really made an effort to practice positive self-talk and listen to positive music. I was literally so much happier the whole week." Female 2 says, "I think they were actually pretty skeptical. I thought it wouldn't work, but listening to positive music was what worked best for me. Talking positively to myself also worked well to uplift my mood on bad days. I also think I would definitely continue to use these strategies." We hope you enjoyed our presentation and thank you for watching.